My name is Billy Pitts, and I'm the Public Health Director for the Marshall County Health Department.
My name is Jamie Hughes. I'm a Human Resources Manager at the Marshall County Health Department.
In January of 2020, my clinic director, Joanna Colson, she had come to me and she says, well, there's this coronavirus thing going on overseas. And so we thought, well, if it gets here, then we need to have our ducks in a row. No one was prepared for this. You know, there were no documents in place, there were no plans in place. We were putting this together on the fly.
We had a group of community leaders that came together, and in that meeting, we had anyone from the judge to hospital management, but we're able to be on this first conference where we would learn kind of a little bit more about the virus together as a community. So we developed a COVID response team, and as we met, we were planning for when. It wasn't if we were going to have a case, it was when.
Marshall County, we had our first case March 28th. Then we had another case, March 29th. So the cases were rising. At the same time, you've got the governor on daily press conferences that's shutting everything down. We faced some challenges, but we became the enforcers of the mandates.
We were tasked with this enforcement of the codes that would come down, and it put us in a real weird spot. As a quasi-governmental agency, that means we work with the county and we also work with the state. And so we have this battle between two things. One of them is enforcing mandates, and the other is trying to take care and respect our community and the individuals that are in there.
That became a tricky balance. The folks that run these businesses, those places were hit hard, and these are people that are valuable in our community. You know, this is their livelihood. So when I say there were challenges, there were, because it's new. You know, there was just no precedent for anything like this. But our whole goal is to protect the community and, and do that with the tools that we had at hand. And I think we did a fantastic job. We really did. I'm proud of the staff. If you remember this past winter, we had that big icy weather hit us for like 2 weeks. And we had just got a load of vaccine. It's like 200 doses. And I got with my staff and I said, hey, look, we've still got people calling. And so we really need to get this vaccine out there. And so we did a drive-through clinic, partnered with the mayor. They just came in and they plowed like a drive area where people could drive through. And almost all of my staff came in. And other ones brought people in. We all got together. And I'm gonna tell you, we actually had a really good time. So we got through all the vaccines, got that distributed even through the bad weather. And I was just tickled of the staff with how they came through and made that happen.
They've handled a very stressful situation with grace and dignity. Being able to, we're talking about the stress that goes on home from what's going on with COVID and then coming to work and it increasing. I think that just says a whole lot about our staff and our leadership at the Marshall County Health Department and how we work with the community.
The Healthy at Work guidelines that Governor Beshear was implementing last year was a work in progress for them. They're trying to figure out how we're going to get back on our daily lives. And so one of my jobs as the health department director is when a business owner or a community member or someone, they would call me and they'd say, hey, Billy, I got such and such going on. Okay, can I do this? Can I do that? And it really turned out to be a great, I thought, a community partnership.
With Safe at Work, it was an interesting thing because each individual business organization had its own rules. And so it became a struggle for us to try to figure out when someone would call, we would have to go back and look at each individual thing that the state had put out to make sure that we handled it right, because it just didn't go across the board to everyone.
And by this point, vaccines were working, doing their job. And then in February, in March, and April and May, and on down the line, the cases just started dropping off. And so on June 11th of this year, Governor Beshear issued the current executive order, and that executive order pretty much did away with all the Healthy at Work guidance, all the other mandates, so folks can go and, just as before.
When we went out to do the vaccines in the community, we were able to get our name out there and people see, hey, they're out here and they're caring about us, and they'll drive 30 minutes out in the county to do one vaccine. But that's because our health department does really care about the community.
The vaccine is still available. Okay, we've got pretty much anything anybody wants, and not just at the health department. You can go to pharmacies, you can go to Walmart, you can go just any number of places. And we would encourage folks, that if you have questions, give us a call. We're going to be, watching out for this recent surge that we've got going on. We can beat this. We got through the last bout. We'll get through this.
Our health department does really care about the community, and I think we made a difference.